So we're going to go ahead and get started. We are videotaping, and I can turn that off when we go to the question and answer later. We just want to make sure we're capturing a lot of our public talks and events. And the last time I did this, I did not record it, right? So we now have an audio version of a recent public talk on our Conversations of the Scontras Center series. It covers the 2018 teacher strikes, which started in the South and then circulated throughout the United States, and has led to a lot of recent actions in Portland, Oregon, in Minneapolis, Minnesota, and elsewhere, where teachers are not just demanding better wages, but a say over classroom size, making sure there are services for students so that when they actually arrive at school, they can fully engage in their classroom experience. And on that theme, we want to make sure folks can fully engage in their classroom experience with coffee, tea, and cookies. My name is Kevin Van Meter. I use he and him pronouns. I'm the teaching fellow at the Scontras Center for Labor and Community Education here at the University of Southern Maine. What we do is we provide public programming, training, workshops, and the like, not just for students, but also for workers and union members across the state, so they can fully engage in their workplaces, their communities, and our democracy. So actually last night I was training community members and workers in Biddeford, Maine, to take collective action, how to organize in their workplaces and their communities. Come on in. And today we're really excited to have two awesome speakers that are going to be talking about our theme, which is caring for carceral, understanding the work of self-reproduction. And I think on that theme, we would want to begin with care work makes all other work possible. Care work, the work of taking care of children or elders, or providing social services, nurses, teachers, et cetera, et cetera. Without the work that's being done to care for each other in the society in which we currently operate, no one can actually report to, show up for, or be present for their working lives. So care work is at the basis of all other work that's done in our society. And today we want to focus on a couple of different aspects of that. The first will be, what does it mean to care in a capitalist society? Especially because that work is very often very contradictory. And we'll have a speaker talking about that issue. And then we'll go into what does it mean to work in social services and care work? What does it actually look like to provide care services and work in social services here in Portland, of course, and in the United States? And our two speakers are Anastasia Wilson, who has a PhD in economics from the University of Massachusetts, Amherst, and they are currently an assistant professor of economics, and this is why I have to read because I'm totally getting your university wrong, Hobart and William Smith colleges, and we'll be speaking about care work in a capitalist society. And our second speaker is Frankie St. Amand, and they are a social service worker and a former nonprofit union organizer that was actually engaged in supporting nonprofit workers and social service workers to improve their working conditions and provide better care as part of that. So without further ado, I'll turn over to Dr. Wilson.
Yeah. What does it mean to care in a capitalist society? It's a great question. I guess I'll just share like how I got into thinking about care work. It came out of a frustration I had. So as you heard, I did a PhD in economics at UMass Amherst, which is like this heterodox economics department that has like Marxists and feminists and whatnot. And there, when we took our courses in political economy and like Marxian economics and feminist economics, care work was this like really central theme in thinking about like social reproduction of capitalism. And I started to get really frustrated with it because the way that care work is talked about in economics is very like, it's like valorizing. It's like, we need to invest more in the care economy. We need more care. We need slower care or faster care, or like we need the right people to be doing the care. Or we need to count it more precisely, or something like this. Like we need to do time use surveys. Like I grew very frustrated with the conversation because to me, it seemed to be a very quantitative conversation about like how much care or who does it. And then I started to question what the word even means, because I thought back to sort of my own like life experience here in this world. When I was growing up, my mother, who happened to also be disabled, was a home health aide worker. And that form of care work was really exploitative. It was sometimes even dangerous. Like she would come home with like bizarre stories of like clients threatening to kill her, and she's like, I don't know what to do in this situation. I'm not gonna call the cops on these people. It's like a, an aging person with mental health issues going on. And so that was like a red flag for me in thinking about like the feminist economics approach to care work, because I was like, wait, we can just like, I don't think being paid better makes this job like any better whatsoever. Thinking about like the structure of like home health care, for example. The other personal connection I had to it was just growing up under surveillance from DSS in Massachusetts, which is Child Protective Services. For all of the reasons of complicated families. I had an older half sibling who had gone into juvenile detention and then into foster care. So then like the rest of us are like having to go to this family counseling all the time, and it's super punitive, and they're kind of tracking all of your behaviors and doing weird psychiatry and things like this. And sort of thinking back to like, well, if we just pay that better, or if we just like have that more accessible, I'm not sure that that changes the qualitative aspect of what that care is, which is like where I get to this question of like caring or carceral. So that's where I kind of started questioning care. And then I wrote a dissertation on the so-called like school to prison pipeline, where in that it became really clear to me that these sort of like sites of social reproduction in a capitalist society, so like the school, the nonprofit social services, the state, and the household, that there was this like carceral sort of backstop to this thing that we call care. That care, for example, the unwaged care work that happens in the household, right? Like Kevin was saying, right? Like care is the work that makes all other work possible. That work is in many ways being regulated and surveilled by the state, largely through schools. Schools where, like, I'm sure as many of you know, right? Like social service workers, nurses, and teachers are mandated reporters. And that can very easily activate these forms of what's called like family policing, to use Dorothy Roberts' term for this. And that was something I like experienced as a kid, like the role of that in activating these kind of punitive social services. And so then that made me sort of think of like, okay, well, what is the school really doing besides just like disciplining kids and sort of making us ready for work? It's also in a way sort of regulating and surveilling the unwaged care work that happens in the household. And so that for me started to put together like a slightly different model of social reproduction, which isn't just, oh, it's a freebie in the household. If we count it better or pay folks to do care work in the household, that'll like ameliorate the so-called care crisis. And then I started to realize, well, no. Like these are just like very complicated nodes of sort of social control about like what this work actually looks like. So then that brings me to kind of where I'm at right now in thinking about this. I'm really interested in how the contradictions of care, the fact that it is a thing we need, but the sort of qualitative parts of it, like how it's actually done, like the actual labor process of it, that activates sort of the carceral apparatus, right, in different forms and different like specific ways. And so I'm very interested in understanding that contradiction, not just from the like kind of meta perspective of like, oh, what's this do for capital, but also thinking about it both in the experiences of the recipient of care, right? Is this always beneficial? This is an assumption, for example, in feminist economics, that care work is always beneficial to the recipient. It's like, this is how it is defined in feminist economics. So I'm thinking about that, but I'm also thinking about how that very contradictory labor process, the one that's activating these carceral elements, what does that also mean for the care worker, right? When you are put in this position to, you yourself as a member of the working class, right, have to activate these elements. And there's this really great quote from one of my favorite pamphlets, In and Against the State, that says something like, these are social services that we need, but in social relations that we don't. And that is like kind of the core question that I'm really interested in. And I think it's one that I'm interested in both from like a worker perspective, but also like care recipient perspective. And then of course, like the larger perspective of thinking about like, what does this mean for our society? And like, where is this need for care coming from? Yes, we have needs as living creatures, but the actual shape and textures of those needs, right? The ways in which capital and the state are telling us what they should be, right? That you need to be like docile and able to take orders and do care in a certain way and have a certain family form, certain forms of care. So that's also got me to a place where now I'm interested in thinking about the form of care, care as work versus care as something else. Yeah, so that was like maybe long-winded. I don't know.
That's what we're all here for, I think. 2 hours.
Shit. Yeah, I don't know. Where should we go? Like, I don't know, Frankie, do you want to share some of your experiences in like running into some of these contradictions?
Yeah, well, I got my notebook to write down a couple of things while we were talking, otherwise they'll leave my brain. But like 2 threads that like, well, really all of what you said resonated. And 2 threads that I've been thinking a lot about in my role as someone who works as a per diem social services worker now. I did work full-time before I started as a union organizer, which I stopped doing just last month, is really like, how are workers valued? You know, you're talking about money, is like compensation enough? And no, clearly it's not. A living wage is key, right? It comes up in every single conversation about this kind of work. And I think probably any of those of us that are familiar with care work, so we're talking about home health aid workers or childcare workers, or, you know, someone who works like myself in a homeless shelter or in a street outreach van. There's a really wide range of what defines a care worker. But yeah, so we know that these jobs, these roles are really undervalued. And so starting to think about like, how as a society are we valuing or undervaluing like this work, and why? Like, what are the, you know, all of the racial inequities and gender inequities that are like inherent in those reasons why we undervalue that work? It is complicated. And in my work as someone working as a union organizer, getting to talk with workers like Allie, social services workers, and really hearing from them, like, these are the ways that we need to feel more valued. A living wage isn't enough. We want to talk about racial equity in the workplace. We want to talk about communication and transparency. We want to say in the mission of our agency and how we're fulfilling our roles. That, I mean, that's really cool. Punitive discipline, that, you know, the organization I currently work at, like many, has we have a discipline policy, and through unionizing, many workers are able to shift away from us, you know, a system where they may just be fired for any transgression to progressive discipline, but that's still punitive, right? And so getting to engage with my coworkers and workers through my role as an organizer, and as someone who led negotiations for union contracts, we're like really digging into those very questions. And sometimes the ways that that showed up, like how people feel undervalued, surprised me, and sometimes it didn't. And then another thing you said, like, is care work always beneficial for the recipient? And no, that's complicated, right? But from my experience as a worker, you know, I'll share that a lot of these systems which are harmful to our most vulnerable populations, like just institutionalization in general, and the way those relationships between care worker, like social services worker, homeless shelter staff like myself, the way those relationships are formed and the way that different policies that an organization govern those relationships, I mean, that can be really harmful, right? And so what kind of work goes on to unpack that? Not just at like that shelter or like in the county between providers, but like at the state level, like those are conversations that aren't being had enough.
Totally. And yeah, that's something that like this kind of project that I'm working on has brought me to thinking about, is that like kind of thinking also about like the work that you've done and like union organizing with like nonprofit workers, right? Is like, how can we have those conversations and have this conversation about like the labor process of care, right? In one that like brings us towards, say, like a more democratic workplace, right? Like what you were saying about like what folks are asking for, right? But also one that considers like, what does our work do, right? Like what are we literally doing like in our production process? Because I think like, so this term social reproduction, right? Like the social reproduction of capitalist society or of capital, I think sometimes something that gets lost in that is like, we're not just reproducing like our capacity to work and workers like in a very simple way, but like we're like, as all members of like the working class, right? We're literally doing things to each other, right? To make us like fit into being a piece of capital, right? Like being like the living part of capital, right? So we are active in that process, right? Like active in our own processes of like disciplining ourselves or imposing like punitive, you're saying like punitive like policies and whatnot, right? So thinking about like how we can flip that as like an organizing strategy for the people who actually have to like do that like dirty work. There is, I forget where that term, like there was this book that from Miriam Wasserman, it's called Demystifying School. It's like out of print from the 70s, where she defines teachers as, she is a teacher, and she was writing teacher testimonies about sort of like teaching during the New York City fiscal crisis. And she defined the work of like counselors and teachers as like soft cops and dirty work. That like this dirty work of care, right, is getting exported to exactly the people who also need it. And that's part of the problem, right? Like we're up against this limit that capital is also imposing on us, right? Like capital is saying like reproduce yourselves, right? But that's actually going to suck for you. And sort of raising that kind of consciousness about that, I think is like, I don't know, I think it could be like a really interesting set of conversations and an interesting sort of strategy. I'd be curious to like hear your thoughts on that, about sort of thinking about like the labor process, right? It's a two-way labor process that we're engaging in, right? Between like, yeah, caregiver, care recipient, and sort of like you're also saying like the relations that sort of at all the different levels, right? Like in the shelter, like in the city, in the state, right? Like you were saying, yeah.
Yeah, I'm not even sure where to begin. I mean, what do you all think?
Yeah.
But
Yeah, I'm the parent of a handicapped child.
Yeah.
Well, I call him a child. He's 55 years old, but he's always going to be my child. The one thing that we are failing so much for these caregivers is teaching them how to care. I had a girl come to the house that the company brought, didn't speak English, only spoke French. She said, well, you speak French. I said, you're here to take care of him when I'm not. You have to be able, I mean, she was a wonderful young lady, but why would you even send someone there? What's happened to the people hiring these people when they look at a demographic of a person that they're going to be caring for? That makes no sense, because the person doesn't speak the language they speak.
I hear what you're saying. There aren't supports. There isn't the level of education or resources to help support people doing this work.
Exactly, and
right?
that's a hard job. I don't care what anybody says. Someone says, oh, they hang around your house all day. Excuse me?
No, it's difficult.
That's not what they do.
Yeah, it's
And I
undervalued.
appreciate her 100%. But number one, she doesn't get paid enough. Number two, she should be unionized. Number three, she should be educated in what her job is. There's no job, I've asked and asked and asked for job descriptions. There's no job descriptions. There's no job descriptions for a person that's a little bit handicapped, a whole lot handicapped, and bedridden. So this person that's used to taking care of someone who has a few handicaps but can pretty much deal, gets sent to a house where there's this bedridden person that they are not trained to take care of. And I don't know, we're failing the caregivers.
Yeah, thanks for sharing that experience. I mean, I think that's a really relevant experience because we're thinking about like, who are the people providing care, and are they also recipients of social services in the system themselves?
Right.
In the case of this person, quite possibly. In the case of myself and my coworkers, absolutely. Like when I was working full-time as a caseworker, a housing caseworker at the shelter, I was definitely like eligible to receive all sorts of social services because I was paid so low. And in the case of this individual that you're talking about, is she even an employee or is she an independent contractor? Like, is she protected by the Fair Labor Standards Act, right?
And no, yes, she is, because they do employ them, the company
Yeah.
employs them. So they do, I did check on them.
I bet you would. But we're talking about the bare minimum, right? And that's
Exactly.
often what the conversation comes down to at the negotiating table, even when people come together to unionize. I'm not saying that the conversation ends there, but it definitely starts there. The employer always comes to the table saying, you know, this is all we're required. Like, this is what state law provides when we're talking about rights of nursing parents, for example. Like, well, actually, Maine is pretty good compared to other states, but Maine says, Maine suggests 3 years of an employer having to provide some things for a nursing parent, such as a space, a clean space, for pumping or for nursing, for example. Like the conversation, even in these social services spaces, where so many of the people on the employer side of the table have been nursing parents themselves, for example. We're always starting at the bare minimum. And when folks are able to unionize, you said she needs a union, definitely. Like when folks are able to unionize, they can build through contract after contract on what they've won, but it's always starting at
Ground zero.
at ground zero. Yeah, and so how are we valuing this work? I keep saying valuing. How are we devaluing, undervaluing this work?
Yeah, totally.
That didn't answer your question at all. It's a good question.
No, but this is also like an interesting sort of point to think about, right? Because like I'm trying to think about like the labor process and all of this, and this point about like, right, folks not even receiving like the training, right? That like they might even desire, right? If
The girl I have now just took her training, and we've had her now for 3 months. And they just told her that she has to take an hour online training. And I've been training her since she got there, and that shouldn't be my job.
Yeah.
But I want him cared for the way he should be. So.
that's also an interesting point to think about, like the role that like families or like unpaid caregivers like interacting with like the paid social services, right? You're saying like you've had to, in a sense, provide training, right? And that's like an interesting angle that like just popped in my head as you're saying it. I'm like, you're also providing for free, right? Yeah, which is speaking also to that gap, right? Like this, why is it undervalued? It's undervalued because we give a freebie to capital and to the state by doing things like this, right? Like we give that free labor, right, in the form of the unwaged component of it, right?
And it's not as if you have a choice in that, but it's true. Yeah.
If I can take that example and kind of flip it in a way, because I had the pleasure of being invited to be a white and male ally for the Domestic Workers United campaign in New York, and then in Oregon and in Vancouver, Washington. And one of the real challenges of domestic workers is historically they've been excluded entirely for labor law. And the reason for that is that if you pay care workers, you pay quote unquote housewives or those who are doing work for free in the house, you pay them a wage as the wages for housework movement demanded in the 70s. That would mean that you would have to pay workers themselves a higher wage. So being able to pay the working class a lower wage, you either get free work or low wage work. That's also the reason why agricultural workers were excluded. So about 15, 20 years ago, mostly domestic workers in New York who were not only excluded from labor law, but very often worked in the homes in an isolated environment. These were predominantly women from South America, the Philippines, and the Caribbean, who would very often have their passports taken. They work 7 days a week, very often for years and years and years. When the kids were a certain age, they'd be dismissed without any kind of warning. They had no actual job protections. They had no healthcare provisions for their own families and children. Very often were sending remittances back. And one of the real contradictions that was confronted by this campaign is very often that the women who were performing this work in wealthy households in New York City were doing so that middle-class white women could go off and work. Right? So there's a direct contradiction between the demands of the feminist movement for women to enter the workforce in certain ways, and then leaning on the work performed by quote unquote women from the global South. And another interesting contradiction to that is very often that those immigrant women that were coming to New York, Long Island, Connecticut, New Jersey, that whole metropolitan area, very often not only had higher degrees in their home country, but were nurses and doctors and had all this substantive education. And unlike Vancouver, Washington, where immigrant women and some white allies and academics were able to fight for parity, saying, well, you've been a nurse for 30 years in the Philippines, why don't you have that same kind of parity with a degree and other forms here in the United States? That was part of the contradiction of that campaign. You actually had very, very educated, experienced people coming from the global South to the global North. And in order to suppress their wages, we just didn't recognize their experience and degrees. And I was proud to say that New York State, through the efforts of domestic worker organizing, was able to get a domestic worker Bill of Rights. California has one. Oregon has a problematic one because it was passed by legislators that didn't involve domestic workers. But for me, the lesson always goes back to that it's domestic workers themselves that have to lead the struggle, and how do we support and ally not just domestic workers, but care workers and others who are doing that work every day. And the reason I raise that is that it was a real learning experience for me as someone who didn't do domestic work, who's cisgender white male, who's socialized as male in our society, and then how invisible that work was. It wasn't until I was riding my bike at 5 o'clock in the morning in Portland, Oregon, to work in an industrial area that you would see folks waiting at bus stations. And it was always women of color who are going off to households to care for other folks' work. So there's an historical context, there's immense complexity to even a small industry like domestic work on how these things operate. And I just wanted to offer that as another example of how complex and how difficult these issues are to operate. But I'll kick it back over to our speakers.
And there's actually a pretty good notebook that came out that gets to this point about especially domestic workers and the sort of flows of domestic workers. It's called Care, the Highest Stage of Capitalism, which is a fun and pithy little title, sort of speaking to this point, right? Like the way that care work then sort of also maps onto global imperialism, right? Again, speaking to what you're kind of pressing, which is why is this so undervalued, right? Yeah.
So I know there's other folks in the room who've done care work or done some of this. Would they like to share their experience? Both wage and unwaged.
I spent 30 years as a prison social worker. I don't know where I want to go with that. It was different every day, and it was hard every day. And it was hard making a connection with people and trying to help them in the institutional setting that it was in. And having others that work there value what I was doing.
That's heavy. Yeah. It also, for me, brings to mind increasingly here in Maine and not enough having like mental health liaisons showing up alongside police when they come to a call for someone who's in crisis. And it exists here in Portland, again, not enough, and I'm not saying it's the right system. It's not the answer, but it's really key. But in Hancock County, for example, where I'm from, you know, when my brother has been in a mental health crisis over the last couple of years, it's been impossible to get someone to show up, right? And so for me, having allies like yourself embedded in those systems, it's deeply important for people who are justice system involved and their families. And also, like, you know, I don't think that incarceration is the right answer for our society. And at the same time, speaking from personal experience for, you know, my family member, in order to get into psychiatric care, it took going to jail for many, many months. You know, there's a deep lack of resources and available resources. And so, yeah, the work you do is incredibly important. And like, what is it like to do that work on a daily basis with people who may not value the work you're doing?
Because a lot of the officers, and I started as an officer to get into, I had to start online, and work 6 years into the license over.
Yeah.
We didn't have, when I started in prison, there weren't social workers. You just had officers, you put them in, you kept them there all day, and that's what you did.
Yeah.
And we built social services from the ground up.
Yeah.
We developed a program. We started files. We started paper trails and started trying to look at systems and how we could better their time inside. So when it was time to go home, they had a basis that they grew from. So when they walked out the door, they had something.
Yeah.
But a lot of the staff didn't feel that our work was needed. You're not there to help them, you're there to keep them locked up. And when it's time, throw them out the door. And unfortunately, I'm not there anymore, but that's still a belief today.
Thank you for sharing that, because that also gets to this sort of really, like, in the sort of stuff that I'm working on, this underlying question about like what type of like ethic is being evoked in the work. And you're sharing what you're sharing here, you're kind of running into the exact contradiction that I think I'm most interested in trying to understand people's experiences with, which is I want to care, right? I want to be able to provide those services that like facilitate reentry, for example, or just like make people's lives hopefully easier in getting out of that system, right? But then coming up against the institutional ethic, which is a carceral ethic, right? Yeah, thank you so much for sharing that, because I think that is like a really clear example of exactly this. And also what you were saying, which is that like it took sort of the collective action of like the social workers themselves, right? Like you said, building that system like yourselves, right? That's really interesting. Yeah. Thank you for sharing that. Do you want to share other experiences?
I'm like, this fits in somewhere because I work at, or I used to work at Sexual Assault Response Services of Southern Maine, which we unionized with the heavy help of Frankie. But my position there, I worked with their children's program, and we worked specifically with the district attorney's office, police, and DHHS, Child Protective Services. And so we were at the intersection of all of those investigating folks in allegations of child abuse. Which brings in, let me go back. It pulls back the curtain on a lot of things, because I felt I had hesitancies coming into this position, even though it's like this wild, crazy system conglomerate helping kids and families maybe, and definitely sometimes, but also definitely not sometimes. There are a lot of complicated cases where you just kind of sit there and you're like, that's what you did, that's the call you made. So there's that, but it was also, right, this helping kids and families, like this is the only avenue kids and families are told that they can go down if something comes up like this, right? School mandate reports it, their doctor, you know, whoever, someone around the town, neighbors, we get all the time. And it does have this, okay, here's your option for engagement. If you don't engage with this, there's nothing we can do. Like a lot of times, even if someone brought something to police and said, I really don't want DHHS involved, it's, you know, it's not involved with my family, it's whatever, and they still have to call it in, and then hypothetically, you know, that very well could open, even though it's not an intra-familial, which is usually what they like get engaged with, is when it's something nearby, close to home. And sometimes they would still open, and that family could then get totally railroaded for other stuff, right? Oh, they don't have heat. Oh, they don't currently have hot water. They're showering, you know, elsewhere doing something else. And so it is very, very complicated trying to ethically navigate when we have these families come in being like, no one taught me in any of those silly little parenting books what you do when your kid discloses this. Like no one ever told me what to do other than call the police, call DHHS, and they'll tell you what to do. But a lot of the time, their opinions and their biases are on full display, right? That curtain was totally pulled back. And all the time you get things like, oh, I think she's lying. And right, our job at the nucleus of this was to be like, you can't assume that, right? Check your hypotheses. Why else could this be happening? What are the other reasons? But all of the time you could just see how very singular decisions from these investigators and from folks that we are working hand in hand with have unbelievably detrimental outcomes in the long run. And we just sit here and it's just like, but this is your option, right? Like this ball is already moving and you are locked in, like you are stuck on this. And so it fits into a lot of these different kind of puzzle pieces. But yeah, it was wild, and it definitely is tricky witnessing systems, especially people, right? I work with DHS workers every single day. They come in here and they're like, oh my God, I was at a hotel for 3 nights in a row because we have a kiddo there because no one can take, you know, like all this stuff. It's like, wow, you need a breather. And then we get like law enforcement coming in being like, I handled this really traumatic thing last night, but I'm here. And I'm like, go lie down. Please God, go lie down. And yeah, so it definitely feels like a lot of these things are overlapping. And trying to navigate that is. Yeah.
Yeah, thanks for sharing that, because one of the things that you said is something that I think is just like really illustrates like the core of the problem, where you're saying, right, like one, who else do we call, right? So like if something occurs, or if it's like a mandated reporting situation, like, right, the social services are activated, yes. But then the way in which the system can kind of snag you for being poor, right? For like not being able, like, right, you can legally find yourself in a situation of being maybe like charged with like neglect or something like this because like you can't afford heat or good food or whatever it is, right? And sort of thinking about that as like, to me, like when I think that's very like, it illustrates this point, which is that like under the constraints of capitalism and of like wage labor, and the fact that capital depends on getting this free unwaged labor from the household, then it also puts the household in this like snafu of both like, I have to reproduce, right, like our ability to work and whatnot, but I'm actually not even given the basic resources to be able to do that, right? And then we activate these punitive systems, right, in order to be like, well, somehow figure out how to do that better, right? Figure out how to, out of nothing, be able to provide a certain standard of care. Yeah, that was a really interesting example that you gave there. Yeah.
And because I'm always trying to talk about unions. I will say that for you and your coworkers, similar to so many other social services workers that I've worked with, your reasons for wanting to unionize, right, to advocate for yourselves, were also to advocate for your clients, right? It, like, sure, again, everyone needs a living wage, no question, always part of the equation. But yeah, you're there because your clients deserve better, and it's on the front lines, you see some of the flaws in the system that could be improved, and you want a voice in your own agency, and you want to be able to participate more fully in discussing the system. Communication, transparency, and justice, right? Equity. Those are like the themes that I hear over and over again. And from the employer side, and I'm not trying to vilify every executive director or board of directors. That's not what I'm here for, but there's a common narrative there as well, which is that social services workers, care workers, asking for a union, fighting for a union, are selfish, right? And are taking from their clients. Pretty much every single time, right? And that's not true, but there is this like scarcity mentality, right? Not just within the organization itself, but within all of the organizations. The nonprofits here in Maine, let's take Portland, for example, they're all fighting for the same pot of money, right?
Well, it's like scarcity on top, it's pulling the string of like the hyper individualization of like, right, all of this care work. Like, how many people feel like you have to get help from other people because you're being, right? There is, who else could I ask? Who else is in my bubble? And I feel like it's an extension of that, because you're right, like, how many, like, I know specifically from the sexual assault side of things, the domestic violence money is like, they get a lot of money, and the whole thing is, oh, like, I want some of that to help some of these clients, but it's like, do you know your clients are over there? The days that they're not over here, like the overlap is unbelievable, right? And they're going to Preble Street and they're using these social services because they're in positions where they have no other options. They need to outsource these positions. But I also feel like it's the extension of, and I thought about this a lot during bargaining, just feeling like, right, we have, like, this is what we're working with, scarcity, exactly.
That there's different pools of money for people who have survived sexual violence versus domestic violence, as if those are not entirely intertwined. Yeah.
Question. Speaking of unions, I was wondering about, when you're talking about unionizing, say, home care workers, what kinds of tactics can the union employ? I'm thinking that strikes don't make sense for a few different reasons in that context, including the fact that you be leaving the patients who depend on you without care unless the agency, which they could easily do, hire temps or whomever. And so it just seems like a situation in which it's hard for the workers to really flex any power.
I have some thoughts. You probably have some thoughts.
Oh, you go
Yeah.
first.
Being adjacent to those fights. I will say, so like, what power do we have as workers, right? Strikes are often the last resort, because often to strike, a person goes without pay unless there's a strike fund. But that's a really good litmus test for how strongly people feel about an issue, Like, is it deeply felt across the workplace? Is it widely felt, right? If an issue is so egregious that an entire, workplace worth of workers are gonna walk out of their jobs and picket in front of their employer's building or workplace, that there's like something pretty egregious that's happened. And it's a powerful tool. Withholding our labor can sometimes feel like the strongest tool we have. But there's so many ways that workers can come together in a workplace. If they're employees, so unfortunately not if they're independent contractors. I mean, there are many different ways, but they don't have the same protections. So if they're employees, they can come together, and under the National Labor Relations Act at this time, they are protected for talking together. So that's just two employees in a workplace of 500, right? They're talking together about wages or working conditions. They're protected, right? So that means their employer should not be able to discipline or fire them for coming together and organizing, whether or not they're talking about a union or not. That's pretty cool. It doesn't mean that an employer won't fire them. We went through this, not with you, but coworker. So I've just because that there are protections in place doesn't mean, and I've stood by the side of people that have been fired by their employees for talking about wages with their coworkers. But it might start in a workplace. Workers might come together and decide that they're going to write a letter to their boss and they're going to sign it. And for people who haven't taken collective action together, that might feel like a really scary ask to put your name down. But when you say to your coworkers, we're going to sign our names to this, but we're not going to walk it to our boss's desk unless 80% of us sign it. So we know that, like, it's not just me, Frankie, whose name is on this. It's 90% of us in this room. That's pretty cool. And even a seemingly small action like that can send a really powerful signal to an employer. And I think actions like that are really important to start to build solidarity among a group. So it's not just showing collective power to employer, but it's flexing your muscle and starting to build your capacity with your coworkers to take actions like this, because no one's going to be able to strike tomorrow if they haven't been working closely together with their coworkers to get ready to take a scary action like that. So there are all sorts of creative things, some legal, some illegal. We're talking about strikes. Let's think about the public sector. Here in Maine, for example, where our public sector employees, say DHHS, for example, you brought them up, like technically under state law, they can't strike, but no one won the right to strike by going and asking for permission. So the other question is, how do we do it carefully? Like, what about our clients and the service provision that we care so deeply about? And to that, I suggest, and I'm no expert, though, we turn to the nurses who are so badass, right? And are just one example of many, who have figured out in, many different states here, there are great examples about how to strike carefully so that, and they set up entire systems in which they're still able to provide some services to the clients and the patients in the hospital, while also standing out like in large groups and like taking on their employer because they're working in like dangerous and deeply understaffed situations themselves, right? So it's not selfish to say we've had enough. This is like really unsafe.
Informational picketing is one of the best tactics for state employees who can't start. And you can set up times and you can bring people in. And you can start small with actions. You can start with an action that everybody wears purple on Tuesday. Or you have a purple leaflet that is photocopied and it's in your back window. So when in the parking lot, everybody that pulls in the back window, everybody has a purple flyer that says something. Small actions to work up when you pounce.
I want to direct respond to yours in your comment, only because I'm in the midst right now before Michael's question. only because I am, at this very moment, supporting a group of 109 social workers in New York City that have been on strike for a month. And I've also been involved in organizing home healthcare workers and supporting home healthcare worker folks who've threatened a strike and have done exactly the kind of actions you're talking about. And have had the great displeasure of working with like nationally renowned progressive nonprofits that might post about Labor Day and May Day and trans rights and Black Lives Matter, and then literally file Black trans folks for standing up for their rights in the workplace. This is not a new question. This is a question going back over arguably 75 years to 1953, when the first writings about wages of housework are being posed. It's how do we strike against the work we have to do every day while not striking against those who are caring for it. It's called a very careful strike. Came out of the wages for housework movement, and then more recently a group in Madrid, Spain called Carceral, but it was mostly immigrant women in Spain who are trying to get a decent wage, but also not striking against those that are caring for. And it's a very, very difficult question. And I think to Frankie's point, nurses and care workers and others have set up various systems in order to make sure that their patients and their children at home, their elders at home are being cared for, and that maintains. And those systems of care are constantly being maintained. Part of the issue, and this came up in a direct campaign I've had some experience with in Oregon, is that home health care workers, so if you care for a parent, a child, a spouse, a sibling at home, an immediate and they've been able to expand it, actually to expand the definition of family, which we need to do, beyond the nuclear family. In Oregon, you are actually an employee of the state, and you're represented by an SEIU local. The question came up is, how do those workers strike? How do they strike against that work and make sure that they're not striking against those they care for? And the solution was creating long-term systems of care. So literally being paid 40 hours of work to care for a parent or a kid that is bedridden. 40 hours doesn't cover it. Literally, that is 24 hours a day, 7 days a week, every day of the year, very often for life. And what that meant was that those care workers who were not being paid, right, they were part of their families that were out, quote unquote, working for a wage outside the household, were creating systems of care through communities and neighbors and others to make sure that their loved one was going to be cared for, while those who are being paid for that work were able to strike against it. And very often we were getting to the point where they were literally going to occupy the offices and picket the homes. I'm a big fan of home demos of the legislators that were not willing to raise the wage of those folks who arguably worked and were paid for 40 hours or 35 hours a week with some very basic benefits, but literally were working 24 hours a day, right? So they were willing to take, after years and years and years of this, militant action by saying, well, I have to care for and I'm paid to be caring for my person in my home. Who cares for rich legislators, their kids? Women from the global South, poor working class white women from rural Oregon. So we're going to go to your home and we're going to tell your neighbors that because you make a upper middle class salary, you can pay for a home healthcare worker to care for your kids or your special needs kids or your elders, but you're not willing to pay a decent wage for those who are doing that work in their own household. We find that contradictory and immensely offensive. So we're literally just threatening to do home demos or stand out on corners or occupy their offices. So the largest social movement, and then I'll stop there, in all of US history, which gets literally no credit and has only 2 major books on the subject, is the welfare rights movement. So per capita, the civil rights movement, maybe 1.5% to 3% of Black folks participated. It's about 5% of the US population participated in the environmental movement. It's 1% to 2% of women in the feminist movement. The welfare rights movement, which is led by women of color, is about 8% to 10%. The reason why social services were externalized into nonprofits in the 1970s is that Black women would say and occupy offices of welfare agencies and say, first, you don't give us enough money. And second, you're not coming to my house at 2 o'clock in the morning, knocking on the door and looking at who's in my bed. Because they found a man, they said that man now pays for your kids. They found a woman, they took her kids away. So there's been massive changes in the last 50 years in order to mitigate and prevent people from making demands about things that they should have, which is a decent wage, 24-hour care when they need it, right? An actual break, as you're saying, after dealing with an immensely difficult phone call or helping a child who is currently staying in a hospital. So what we need to do is not just empower and listen to these workers themselves and get behind their struggles and ask them what they need and how we as allies support them, but also say, how do we take some of that work as a burden off of them? And we might be 75 years or 50 years after the feminist movement has emerged and made demands on these. But according, at least globally, and especially here in the United States, if you look at the ratio of unwaged reproductive labor in the household, it has not changed a bit since the feminist movement. So most work is still being done for free by women and gender nonconforming people in the household. And that men such as myself are not standing up and holding each other accountable in order to challenge that dynamic in our relationships, in our communities, and in our households, and then also not standing up when care workers were mostly women or gender nonconforming folks making low wages or making demands and saying, we will take that work on for you so you can go out there and picket and strike and occupy. And that needs to be a labor movement demand, and it needs to be a social movement demand, if that makes sense. So Michael had a question and then you, sorry.
So, hi, Anastasia. Great to see you as well. So Michael Pillard, I'm a political economist, so I'm gonna ask a macro question. The way I tend to think about topics like this is that, you know, we have a very rich society. GDP per capita doubled in the last, 40 years, all of that. We could afford to decommodify all these different things, meaning that we could raise through taxes enough money to fund, whether it's, all the different branches of care work that encompass in many different areas. And when I think about like having the politics of this to be able to talk to the public, like it strikes me, thanks to a lot of things, Occupy, Burning, whatever, people like who want to do the right thing have a vision of what decommodifying healthcare would be, which is saying single payer healthcare. Maybe the British National Health Service would be a better model, but anyway, some version of that. But people know what it is. When it comes to housing or all the different branches of care work, people don't have an idea about it. And it's like national care, single payer health care would be to raise some taxes so that we can get their health coverage. I think the best example actually is military. Like we have this thing that is not a commodity, something provided by the state. And boy, everybody agrees that we fund it to the hilt, and we can do that for everything else. So I guess I'm wondering, like, what would be a language or a politics to present to the public to say that, we already, to the most part, don't fund this. We fund this in this weird way, right? Some of it's, it's weird. Right? It comes from a lot of different sources, including charities and foundations and stuff like that, and some from taxes, whatever, but it's inadequate. It doesn't provide for a living wage. It doesn't provide for the kind of quality that's needed, the training, the resources, all of that. So if we were going to ask for something and call it single payer, whatever, care work, what's the discussion about that? What would it look like to develop a politics like that at the national level and politics like that at the state level?
Yeah, looking at me because you said macro.
Okay, we're gonna come up with a solution right
All
here.
right, let's do it. Economic policies, they're easy.
That's right. And it's one that's shared. I think there's an audience for people who would believe in this, but they don't have the language or the vision to talk about.
Yeah, no, I think it's a really interesting question because it also, like, another kind of going back to like the kind of long-winded introduction that I gave, like another question I've been having about care is this term care economy, because I think it might be a dubious term because like the care economy language, right? Like on one hand, I think like that is the discourse that's happening. To answer your question, like I think that's where it's at, is people are talking about like invest in the care economy. We don't know what that form really looks like, right? So like your question stands, right? But the care economy language, I find to be like problematic and dubious because like, on one hand, you can like see like, you know, the Biden administration talking about like robust care supports, which really just means like tinkering a little bit with like the supports that people get in very backhanded tax ways for doing things like home care, right? Like, cause that's what like came out of, or like Build Back Better, right? But on the other hand, in the same breath, that opened up, so fun thing to do like after work is to look at what hedge funds are saying about the care economy, because
A fun thing to do.
a fun thing to do after work. Just, you know, Google what those folks are saying about it, because like I was reading this report from Accenture, and Accenture is like, care economy, we've got a $3 trillion GDP increase, like ready, just like, you know, as long as we can unleash the forces of hedge fund capital into this care
And it's probably
economy.
really taking over, sucking dry, which is what to do.
Exactly. So it really just means like, right, buying up your nursing homes and hospitals with your private hedge fund, but yeah, exactly, commodifying it. And you're asking this, so like, what I'm trying to point out is that the question, it both opens up like this idea of like like the capitalist care economy, right? But then you're asking like, well, what is the alternative, right? Because that question I think has led to like in my, like, this is my problem with the word care, is the valorization of it as like an economic thing, right? As a commodified, alienated thing. So to answer your question, like for me, and this is probably also because I'm not sure that things that are provisioned by the state are decommodified. Like this is a question that I have in theory world. But for me, I'm thinking about Kevin's answer to like, how do we do the careful strike, right? And that this required forms of organization, including like activating like community supports, right? For like when nurses strike or when domestic workers sort of do a form of a strike, right? And I think it's within those spaces that we can actually see what the not commodified form is, right? That's where you see like, oh, the care commons could emerge out of these forms of organization. So I think to me, like that's a more interesting language of thinking about like the care commons or the care commune, right? To actually think about like truly decommodified, right? As for thinking about like, is there some sort of like reform model out there? This is why I'm interested in care, because I'm not sure that there is. I don't think there is. Like, I'm not sure if I like can just be like, oh, national care services, like, like I think that sounds like more of the same problem, right? Maybe just organized differently, right? Like with a different industrial organization to it. Yeah, but I think that's like the $1 million question there. Like that's, yeah.
And just follow very briefly. So I've taught about this on other topics, but transfers really well on the idea of fighting for a social wage, right? As sort of a broad left, you know, agenda. And, you know, to me, like in conversations with students about higher ed, it's like, what would be like, you know, because the whole history of higher ed financing is how do we not pay for it through taxes? And how do we create a opportunity for a financial industry to make this huge amount of money, et cetera, et cetera, et cetera. We know the history. And the thing that I would say to my students that seem to be compelling is like when you go to your middle school as a child, they don't charge you a fee on the way in. There's no, you know, extra things like that. You don't have to take out money to pay for it. It's just like, so I'm thinking that the value of analogies about public is there. Social ways that we do have. You know, the military is the best funded one and nobody even questions it. And you know, K through 12, it's got all kinds of problems, but it's like you pay taxes, the taxes pay people living wage more or less, if you use it strong enough, and it gets taken care of. So I think, you know, like bringing a language of, hey, we do some of this already, it's not a big deal, people don't even question it. And things go well over there, relatively speaking, but here it's like terrible for everybody involved. And stop it.
We move for our next question. Frankie, one of the things that you really highlighted for me in your comments was it's not even just about resources and money, it's really about control. I was wondering if you wanted to say a little bit more about, especially with your experience as an organizer and somebody who's worked in the social service, how important that is, or if there's an example that you wanted to draw on.
Yeah, I mean, I just think it's about what are we prioritizing?
Yeah.
Like you said, it comes down to who's in those positions of power and who's making the decisions. And for me, I'm always these days now thinking about an analogy of like a, you know, a bargaining unit in a workplace, which is diverse. It happens to be everyone who works.
Yeah.
You know, for a certain employer, and like when you select a bargaining committee who's represented on that committee, and when I'm thinking about housing in the United States, like are like houseless people like represented, you know, in those higher level decision making spaces, and the answer is often no. And I mean, it's like there are a lot of problems with our political system. You know, I mean, I don't know what could change besides a drastic shift in the way we structure our society. Like what is going to change to help prioritize that more? And I am so disheartened to think about examples like Cumberland, Maine, which just, you know, a week or two ago, 2/3 of Cumberland voted to reject of, you know, affordable housing within their boundaries. That's high. Dot, dot, dot.
Question.
It changed a little bit because of what you said, and I liked the term you used, the care commons, because like, to me, the whole framework of social reproduction under capitalism starts, to me, with the nuclear family, even though most families don't look like a stereotypical nuclear family. That idea of privatized reproduction in the home, one wage earner, you know, none of it's real, but the ideology is really powerful. And so out of that, you know, women's labor is devalued. So even I'm a public school teacher, so I get paid, but the work is devalued. And then you're in that position that you were sort of describing, that it's a toxic situation for the person who's doing the caring and for the person who's being cared for. Which is why, as also a union activist, I'm very much in favor of like bargaining for the common good and connecting union issues to social issues. But I think that back to the thing about the care commons, I try to envision what would it look like if we could collectivize the care work in a way that isn't run by the state because of the inherent, not necessarily inherent, I mean, I'm a public school teacher, but because of the potential for that policing of it, of the social control, but that's also not institutionalized. So, I mean, I think I think there's a deeply radical solution. I don't think it can happen under capitalism, but I like to think about it. But I also, as a public school teacher, really think that teacher strikes are extremely, they're a great example of so many different things. But one of the things that they're a great example of is the value, not the economic value, social value of this care work. Because I got to go to Portland, Oregon this last fall when they were on strike. And that city was, I mean, it wasn't like a general strike ground to halt, but it was, you couldn't walk around the city without seeing signs up for the teachers. And the teachers' demands were smaller class sizes, raises, you know, real economic things, but also they raised issues of racial equity. They raised issues of housing. It's a very gentrified, very polarized city. It's not unlike Portland, Maine, in a lot of ways, but so the teacher strikes are very they're great examples of that power. And it's true, like the kids don't get to go to school while the teachers are on strike. You have to have, and that shows the power of the work you're doing. If the economic power has an effect on the community and the city's economy, but it really shows the value of the work that's being done. And you know, and it was a wildly popular site, so the community supported it and made it work so that it, you know, I know teacher strikes are great, but they're also very vilified in a lot of sectors. So, yeah, so there's a lot that was great. So I just want to throw those things in there.
Yeah, thanks for offering that.
Mhm.
But like you said, they're also very vilified. I'm thinking about the teachers in Newton, Massachusetts,
Yeah,
who are being
exactly.
sued right now for going
Yeah,
on strike.
Because it's illegal in Massachusetts.
Yeah, exactly. There's a new strike clause for public sector workers, right? And I think they're also being like, there's also parents that are suing them
Mhm.
as well. So like, cool. Yeah, and like your response also reminded me, just like iterate again, like thinking about like the common good or like the public good, kind of like what Michael was saying, right? Like, I think part of this, and also back to what Frankie's saying too, like part of our like organizing strategies also have to be that like within that, that's where we actually develop those forms of like a care commons, right? Like we get it through the organizing like that is the care commons is the organizing strategy, right? To create that as a way to be able to do the careful strike, right? Without sacrificing the things that like we actually need, which is like going to school or providing childcare or long-term care for folks. Yeah. Thanks for sharing that.
Yeah, all very great comments.
Just want to offer an historical example for that. I have wages for housework on my mind because I have to write a book chapter about it, and my mentor is one of the founders. I owe her a return phone call. But the argument that they made across the planet actually in the 1970s was the fundamental difference between demanding that the state provide childcare and us organizing childcare and demanding the state pay for it, right? And I always thought that was profound because the challenge that they had was when childcare was provided, it was low-wage jobs, not union, right? Folks weren't properly trained, really given the opportunity to control their own workplaces, et cetera, and it was different when they organized their own childcare collectives. And I've had the real displeasure of organizing low-wage healthcare workers in rural Oregon, which is a childcare desert. And we had folks who were literally driving an hour and a half over mountains to leave their kid in the morning, and then hopefully it's not an emergency, and then going back at night. And one of the solutions, the only solution we had, because employers, the state wouldn't pay for it, was how do we organize and then force the employers and the state to pay for that? And that's something that we had only just begun as part of the bargaining for the common good. But just to offer as a historical example, because there's a lot of solutions and strategies that folks have been trying for 150 years we can draw upon and look to. And really the question is how do we popularize those? How do we organize those? How do we bring that up in our bargaining? How do we bring that up in our labor movements and our classrooms and places? I think we had some folks who didn't ask questions. Jason was probably next.
Yeah, so I'm trying to think through this, like decommodifying or care commons, and I'm going back to what what you were talking about at the beginning, that all care work is actually reproducing capital, right? But it also seems like it's not just doing that. Like I'm trying to think about a dual nature of care work. Like you're caring for the person, whether unwaged or waged, as a parent or caregiver, as a teacher, and so on. But you're also preparing them to be a worker or dealing with the repercussions after they've been expelled from the workforce, or for those who can never really enter. And so I guess I'm wondering about like, can we think about the dual nature of care, that it's always care for a specific person in a specific context, but it's also care for reproducing the social relations that they're going to enter into. If we think about ways of sort of splitting those two, like in the way you might think about, like part of decommodification is prioritizing use value over exchange value, saying like, look, people need this thing and they should get it regardless of their ability to pay for it. Like people need food, so you just provide food. And so I guess I'm wondering, can we think about ways of sort of separating out care as care for the specific individual in a specific situation, and care as a reproduction of existing social relations? Understand they're always thoroughly intertwined when we deal with them.
I love this question because this is like the question I keep thinking about. And from like a nerd academic perspective, I've been thinking a lot about trying to identify like forms of care, right? Because I have a semantic problem with this word at this point. I'm like, this word is confusing. We use it all of the time. Like care economy, I don't care, who cares, care worker. And I feel like it's like a very obfuscated word. Like I actually don't know what it means. Like this is a personal problem I'm having. Like, I literally don't know what this word means anymore. Because we say care, both like I'm a care worker because I work a wage job in a certain occupation as a nurse or whatever it is, right? But we also say like care, not cops, right? Like we want like more care so that we don't have like such a carceral society, right? and care economy, right? Like whatever, investing in these like forms of jobs, but also unwaged care work. And there's this like, I think there's a number of books that start with this, like the etymology of the word, because it is a funny etymology where like care actually means like worries and burdens and like troubles that are like being imposed on you, rather than like care, like a loving, warm, fuzzy feeling that I get because I help somebody take a bath, like, right? Like these are very different concepts, right? So I think like, yeah, exactly this, like identifying different like forms of care and of reproduction, of social reproduction. So I actually just finished writing a review of Michelle O'Brien's new book, Family Abolition, where I really appreciate that she starts doing this, because one of the things that she starts talking about is insurgent social reproduction, ways to reproduce us, right? That are not reproducing those social relations. So like you're saying, right, like use value over exchange value. Because I think having conversations about that, like, no, how do we reproduce us and like what we want, what we need, what we desire, regardless of how much it costs, right? Or regardless of the resources that it takes, right? Like, how do we do that without those constraints of having to do the part of reproducing, right? For capital. Yeah. So thinking about like these forms, so like I've been thinking about mapping these in different ways, like the insurgent forms, the deviant forms, or the everyday ways that it comes up, because like we were talking about like these constraints on the family and the constraints on the social services, people come up with ways to figure out how to take care of themselves. Like they do that all the time. People are actively abolishing the family, you know, by choice or not, right? And actually like identifying those and giving, like you're saying, like some language around that, right? That's actually really helpful in figuring out how to organize and push that more as like a strategy, as like working class strategy. Totally. I like this question so much. Yeah. Other thoughts from other folks?
I was thinking about this idea of care commons and how it intersects with capitalism and our culture today. That I remember when I was in grad school, we read an article by John McKnight called "The Caring Professions, Don't." And he talked about, he said in the 50s, the occupation grief counselor didn't exist, because when somebody died, the neighbors brought casseroles and sat with the person, and it was all, we knew each other, we cared for each other naturally, we didn't have a need for this profession, and how our separation ended up creating, he really rails against the grief counseling profession. But I was just thinking about, we don't know our neighbors today, like we have about care commons, and I was thinking like, and I hate ring doorbells, so very much. I ran against ring doorbells, but the fact that we put up surveillance cameras on our houses to keep people away, and the reason that people started doing that was to protect their packages that they bought on Amazon. So it's like there's capitalism preventing us from knowing each other, caring about each other, because we care more about our packages. And so like we have a lot of work to do. Like I love that care commons idea, because I agree with that. You know, we knew our neighbors, we take care of each other. And I'm just thinking about why is it that we see this as always being institutionalized? Why do we always have to turn to an institution to provide care instead of just, like if like with Joe, you have a woman that Joe can't communicate with, but there's somebody down your street that could sit with Joe for 3 hours. It's just that kind of thing. And it just hit me like, yeah, but that's so intertwined in capitalism that it's keeping us from even wanting to know each other. We put a camera on our door so we can get a alert and say, oh, you're on my porch. It's just where I'm going with that.
Yeah, totally.
I think we had two more, Michael, and then Allie, was that a hand or?
I just briefly wanted to mention the Bedford strikes as an example of massive movements that were organized from the bottom. The State Teachers Association eventually got involved. But there were legal strikes. They were organized by people who weren't real active in or anything like that. They were clearly bargaining for the common good strikes in all cases. And it's just a lesson that should be in everybody's mind. People should know something about it. Stephen Greenhouse's book, Beaten Down, Worked Up, is a good account of it in one chapter. There's a new book that's out that we have a book thing. So some activist scholars, like when interviewed when we found out about it, particularly the Arizona case. is the one that's really, really optimistic because they created a permanent level of activism and influence in policy. So people should just know about that because it gives you a sense of like what would be possible. I mean, it could be a statewide care worker strike that's not authorized by any particular union, including a lot of non-union folks, over some demands for like what gets funded. Been done recently in red states. It's amazing.
YouTube/Scontras Center. You can watch, well, listen to, because I screwed up the video, the book talk by two activist scholars, both teachers actually, that did about 120 interviews and were intimately involved in those strikes. So you can listen to their account, which goes into a lot of these issues. You had a question?
Oh, I just wanted, I'm so sorry, I missed the first part of this talk. But I wanted to just expand your comment about the cameras protecting property, but also like now I'm a nurse and I've worked in homes where there are cameras to watch what I do with the patient, right? So constant surveillance culture. And then also, I also work in hospital and people are not allowed to use their phones to video, right? That's like a explicit policy. And, you know, it's about fear and litigation issues. So, you know, it's a much broader issue, but I also want to just mention, like, you know, decommodification is also related to knowledge and breaking through like knowledge silos and sharing community, you know, like really throwing it out there, right? And then also just, I hate the word care. Precisely because I'm a nurse, you're a teacher, and we're clumping us together as if we have the same problems, right? So I have a real hard time with that, especially from a medical perspective. Like, we need to like challenge these systems of what the ways that we've. I'm sorry. And also unions, I don't really think unions are a good model to use. I'm much more interested in creating more like assembly type models in which patients, family members, community members are equally involved in discerning what care happens and who is doing it. It's not about labor controlling, this is a service. It's not at all. Anyway.
Yeah, I appreciate you offering that perspective too, because like when I answer, like that's exactly the question I have. It's just like not only does it affect the worker, but also the recipient, right? And like you're saying, like it is the set of relationships, right? Where like we have one vehicle for organizing that, like through unions, which is like super important. But then like what do we have for organizing care recipients? Right. And that's another sort of thing to like really start thinking about and also dig through our historical examples, right? Our historical examples of like, yeah, recipients organizing themselves, right? Or deinstitutionalizing themselves, right? I think those are also really important examples. Similarly, like sharing that frustration about care, right? Like, I like this again goes back to just like my scholar stuff, like with like economics world, but on one hand, like this term care has opened up a whole discourse that's been important, right? Like care is a form of work. Okay, that is important to recognize, right? And it's also important to recognize like the gendered and racialized components of it, right? Like it's opened up this whole space for that discussion. But then, like you said, like the other side of it is also like, then it also makes this really messy conversation where like the work that goes on in a hospital or in the home or in a school, like these are completely different things. They interlock in like really complicated ways, right? But they are, so they're not the same care, right? Like, so kind of also back to Jason's question, right? Like form. Right? Like what is the form? We need some better language, like to also evoke Michael's question, right? About like what we even mean by this thing called care, or all these things that we're identifying as care. Yeah.
Yeah, I also wanted to, like, I really love your comment about, you know, the union model itself and like, how can we be more inclusive? Like when we're talking about a workplace, there are people that work there, then there are people receiving, I won't use the term care services, you know, like, yeah, like I'm with you. And in the current like version of this world that we're living in, for people who are employed at a workplace to be able to come together and have more of a say in their employment, like they're bargaining over their working conditions. I think that's crucial. And in instances where I've seen people come together, often say at the organization that I work for is a per diem staff that provides services to homeless individuals. A lot of like the people working there have received services from that agency themselves before, have had lived experience, and in thinking about ways to like be inclusive and include voices of like clients or like family members of clients, etc. It's difficult because I think nonprofit organizations thinking about scarcity mentality, like are by necessity, like making money from the state to provide services, and for other reasons, like many quite valid and some I think quite problematic, feel a certain sense of like ownership or commodification around like our houseless community, right? Community members, for example. And so when we've taken actions together, like we'll bring in like union cupcakes and give them out to everyone, like everyone, bosses, clients, everyone can eat them. We get a message right away from the lawyer of the organization saying, what the fuck are you doing involving our clients in this mess? And so this is like a really jumbled response to your quite clear and great comment, which is that like, I really agree with you, and it's quite complicated. And I think like right now, I think unions are one part of really one important part of a solution that needs to like be much more inclusive. Like certainly the end.
For organizing care workers, how you address the tendency for bosses to exploit workers like profits or other sectors, because the work is intrinsically meaningful or valuable to them, right? So not only do they not want to leave their clients behind, but they also feel like they should just be doing this work because it's meaningful to the calling, right? And I guess maybe it's like a bad paraphrase of Laurent Blanc, but like care is like just it keeps on taking. In a certain sense, you can see how alienating it becomes, and I just wonder if that's an obstacle and how that's addressed as organizers.
Yeah, I think briefly, I think what you're referring to is like this narrative partially from the employer that like it's selfish for.
Well, even more like self-talk in that way.
It's like, it's socialized, right?
Yeah.
But many of the people doing this work, yeah. I like look back to our like education systems and like people who go to school like at a 4-year institution to get a degree in social work or like or a master's degree, you know, are expected to do like 500 hours of unpaid labor. I think that like socialization has like deep roots, and I'm not blaming the like education system, like I'm blaming like society and the way we like value and socialize these types of people. These types of people being those people who are performing the work. Yeah, I mean, that's a huge, like as someone who worked in nonprofit organizing, that was like the biggest hurdle is like, I felt like I was like an anti-capitalist, like therapist in a sense, counselor. I'm not a therapist or a counselor, but like how to help people realize their own self-worth and that like they're not being selfish for asking for something.
Yeah, that question reminded me of, again, my complicated relationship with feminist economics, which on one hand, the care discourse brings up this point, like caring professions, because of the nature of the work, there's a predisposition to exploitation, right? Because you care, right, allegedly, right, and someone depends on you for something or another, right? So that creates this relationship, this mediated relationship, right? Mediated usually by the state or by a nonprofit or whatever. Where was I going with that? Oh, where I was going with that is back to the Accenture report that I was reading this morning, because, which they were really selling me, like, I'm gonna put my $3 trillion for sure into the care economy, because the returns are gonna be great. But one of the things that they were also selling me as an investor in the care economy was like a care work ethic, because the whole sort of the way that they're selling this is that this creates jobs. This creates jobs, social jobs, because they're caring, right? This creates like this like work ethic momentum amongst those workers. And this is why the returns on this are going to be great, because we can guarantee that folks in these caring professions are going to work really hard because they care so much about the social type of work that they're doing. And this brings me to like a sort of more a peer conversation about this idea. By the way, the report also calls the care economy the fourth industrial revolution. So it reminds me, cool, right? Cool. Yeah, I was just also thinking about like I know there was a talk here a couple of weeks ago with Sarah Jaffe, right? Like this care work ethic, right? And how that then not only a predisposition to exploitation, but then some real challenges to organizing, right? But it's also something that I think is becoming more ubiquitous across professions, not just back to Ashley's comment, like not just like care work professions, but all professions start to turn into care work, is sort of the way I've been thinking about this as this the fourth industrial revolution takes off, is that like more and more professions start to look like care work professions, right? It's also like the effective labor argument, right? Like that more and more things turn into effective labor. But that also means that then that labor is really more about that social control, that the work ethic itself has over workers and recipients of care too, right? Yeah.
I think I saw Doris first.
Yeah, I kind of have, it's kind of a question. Don't you think that a person that feels valued, that gets what she believes she's worth, or he, a much happier work environment person than one who thinks everybody's stepping on them?
You can't have it.
Sorry. It's just, to me, if you feel valued, you're going to do a better job, whether you know it and that you're not doing as good a job as you should. And
Definitely.
that's our.
Seems so
perspective.
simple, right?
I wanted to respond a little bit to your comment. So for me, something that I prioritize is disalienation. And for me, nursing and that type of labor is very much a doorway to the experience of that and an ability to recognize it. And as a way to kind of separate it from the work, labor, that, that language that we use. So I try to see what are aspects that are pushing against alienation. And it can be different with every profession, right? Who engages in sort of care work, but so that to me is very important. And I think it's power that is within framing it as a care economy. Like, well, we could maybe embrace that as a way to change it. I'm not, but anyway, I think about this a lot. So anyway, so that was one comment I wanted to say. And then I also, just to respond to your comment, being a nurse and also home health aide for many, many years, just because you do your job better doesn't mean you're taking care of someone. These are tasks, right? This is the whole nursing and home health projection is about completing tasks. And you can treat a human like a sack of potatoes and complete your job really well and be rewarded for it, right?
But that isn't what I meant.
Well, I interpreted it in other ways. It could be interpreted in many ways because that's what I see in my work. Because there is rampant neglect and abuse, and I'm not trying to say that racism and poverty and all of the issues that are on top of it compressing the problem and making it worse, but that exists as well. So
Just looking at the time, maybe some final thoughts from, or calls to action from Anastasia.
11 a.m.
Oh, yeah, it keeps going around and it doesn't
Yeah.
move.
Been here for 23 hours.
What was that final
Final
thought?
thoughts.
Well, I'm gonna go get my investments together with Accenture. Yeah, I know, I think like this is a really interesting conversation too, because like, I think what I'm hearing from this is also this very interesting and I think very liberatory thing to notice, which is we all have a stake in understanding what care really is or isn't, right? Because we're all like in the webs of this. It just happens to be very mediated by the state and capital at this exact moment. And I think some of the really important work that we can do either in our workplaces, in our communities, in whatever spheres is like identifying these things, right? And identifying like those forms, right? And trying to kind of like what we were also talking about, like start thinking of like, what is this language, right? What is this discourse, like alternative discourse that we need to push that's not invest your $3 trillion in buying up nursing homes or whatever. Yeah. So those are some final thoughts that I have is part of it is also, right, picking the holes, like tearing apart the word, right, tearing apart the concept, and then figuring out like, what is the actually, like, what do we actually want, right? Yeah, so some final, very scattered thoughts.
Yeah, really appreciate hearing all of your personal stories. Like, we're all connected to this topic in like so many different ways. It's really been awesome to hear from you all about like the ways that like care work, whatever that means, how it has impacted you. And I think like, I guess one final thought, if I were to share one, is not saying unions are perfect. When I think about a nonprofit union, for example, I'm thinking about a worker-led union. I'm thinking about a union that practices open and participatory bargaining and really tries to elevate everyone's voices. So that's a starting point for what I mean when I say union. And when I think about a particular subset of the economy, a particular field, for example, within, I'll just pick, like some type of social services, about like, the type of work that Ally does, sexual assault support services here in Maine. There are, specific organizations that provide that work, that get funding funneled through them. And what does it take to change the narrative in that particular field? And research shows, for what it's worth, that if you can unionize like 30% of a sector, then that has massive ripple effects throughout the rest of that sector. Because an employer is now competing with other employers in the field that are offering $7 more an hour and have a benefits policy and actually pay for the employee's health insurance. I think that's huge. And if we can move past that even further and think about like coalition bargaining, where people are coming together and like showing up in solidarity for one another, teachers, nurses, social services providers. And then even further, like thinking about your comment, like, where are the voices of those people who are receiving services and how do we amplify those voices? I think there's a very difficult and an unclear path for us to make change right there. And there are many other ways, but.
Great. On that note, we're gonna move to close. There are plenty of coffee, tea, cookies. Please take those to go. We have flyers for 2 upcoming events, one noon to 2 and another 6 to 8 on race, class, and gender. They'll be coming up on April 9th. And then, of course, we have our labor history posters coming out of our Celebrating People's History series, celebrating and acknowledging the 1987-1980 paper strike. So take those if you'd like, and just help me thank our speakers today.
Thanks for sharing all your stories.
Yeah.
Yeah.
Yes, and I was gonna respond this afternoon.
How are you? Driving.
My therapist was like, I need to detox, detox